Welcome to the media briefing today. On the stage, we have Dr. John Shok-Kwan, Head of Communicable Disease Branch of CHP, and Dr. Sarah Ho, Chief Manager of the HA. First, Dr. John will tell us about the new cases. Good afternoon. Last night, there were 33 cases tested positive, from 12908 to 12940. 30 cases were found with N501Y strain. 29 had T478K. For the others, the tests are still ongoing. Most cases are suspected Omicron cases. 27 cases were imported. 6 were infected locally. 5 cases are related to imported cases. The other cases are still not confirmed. 12908. The patient is a female who is a cleaner in aircrafts. There was a flight on the 4th of January with 16 cases on board. That's CX845. There were a dozen of cases on that flight. She also cleaned other aircrafts with no patients on board. When she entered the cabin, she met some cabin crew without greeting them or having contact with them. The genome sequencing is pending. We are trying to identify the possible linkages. It's possible that this is an importation-related case. There are 5 cases also related to importation. That's 12909 and 12910. They are family members. They are the household members where the previous Indonesian domestic helper worked in. These 2 cases are the parents and the child. The Indonesian helper's case number is 12854. They all live in Mason building in Tai Po. And also we have another preliminary positive case also living in Mason building. The case numbers are 12909 and 12910. Another case, that is a 12821's family member, a 3-year-old child living in Jupiter Terrace on the 31st of December. He had a breakfast with 3 confirmed patients who are his family members. He was brought to the restaurant later by his mother. He stayed there for 10 minutes or so and had a sandwich and then left. He had a lot of contacts with his family members. It is undeterminable whether he was infected in the restaurant or at home. Also, all 5 cases were identified in quarantine centers. This case as well, the child was sent to the quarantine center on the 4th of January, and then a fever developed and he was confirmed to be positive. Yesterday we mentioned his kindergarten, that is Hong Kong Ling Liang Church Kindergarten. There are 2 or 3 classmates presented with upper respiratory symptoms. They have been tested. All 3 were tested negative. One is his classmate, who is considered to be a close contact and has to be quarantined. The other one is a 71-year-old female, 12913. He went to North Point at Guok Do Plaza, the 8th floor, to meet a friend. It was possible she was infected there. There is another child living in an awning garden. He studies in Qingyi Trade Association Changquanlo Kindergarten. He last went to school on the 5th. He was sent to quarantine center on the 6th. On the 7th, he developed a cough, and his sample came back positive. He is a household member of the Indonesian domestic helper 12903. So these are the confirmed cases. And also we have over 20 preliminary positive cases. I would like to highlight a few of them. The first case is the 66-year-old patient living in Mason building. The previous 3 cases in Mason building all live in Flat D. This patient live a few floors above. The other 3 cases are the domestic helper and the family members. This preliminary case is a 66-year-old female living several floors up in Flat D. She doesn't know the other patients. There seems to be no direct contacts between the patients. They might have been to the same market, but on different days. The domestic helper returned home on the 2nd of January from the church. On the 2nd of January, she returned from her church. On the 5th, she was tested positive. The 6th, she was sent away from the building. Her household members were sent to quarantine on the 7th and tested positive the same day. This patient, on the 6th of January at night, the building was locked down. The sample that night tested negative for the patient. From subsequent samples taken on the 8th, she was tested preliminary positive. We suspect there are environmental contamination causing transmission. Our colleagues and Professor Yun and other departments experts are carrying out inspection at the site. It's possible that some residents there belong to high-risk groups. This particular patient on the 3rd and 4th of January and in the past few days, she went to have breakfast at Fairwood. Sometimes she went to Chui Ping Garden for shopping. On the 6th, she went to an elderly center, Feng Ying Xin Guan, nearby to attend a drawing lesson. There are several people from the same lesson who need to be quarantined. On the 7th, she also went to Marketplace. On the 8th, she bought some food at Qin Dai Ma on Taiwan Road, and she usually has breakfast at Fairwood. Another preliminary case, an 88-year-old female. She's the household member of a close contact. Her close contact is still being quarantined. The contact is not tested positive yet. The linkage being case 12860 on the 3rd of January. That patient went to Zhu Fuk Li, a foot massage parlor. The household member of the masseuse is this patient. On the 7th of January, she was sent to quarantine center. The new preliminary positive case lives in Minghua building in Shaoqiwan. After the 3rd of January, she mostly stayed at home. on Monday, Wednesday, and Friday, that is the 1st, the 3rd, and the 5th of January, she went to Fong Shu Chun Elderly Community Service Building in Shaoqi Wan, the 1st floor, for activities in the morning from 9 to 3 p.m.
And he stayed there till 3 something in the afternoon. I will see whether he had any close contacts or anyone need to be sent to quarantine or for testing. And there's a case with unknown source, another case with unknown source. A 20-year-old woman. He worked part-time at Sogo as a sales. Her last day of work was 20th of December, so that actually, was an early case compared to other cases that we found. She lived in Oikham Hoi Wan, Block 8 with her parents and family. Besides working at Sogo department store, she also went to Onting Estate, worked at the pharmacy there. So some staff worked there, and she stayed there for quite a long time at the place in she lived in Asian Coast. And she had been to the supermall in Taipo from 3 to 5 p.m. January 2nd. And then she went to a sushi place in Taipo from 5:30 to 6:30. She also went to a place to see a Chinese medicine practitioner and collected medicine. And for the other time, she stayed at home, mostly. She stayed at the pharmacy to work. And the last case, a 43-year-old woman, she lives in actually a building called Bunwei Gong. She works at cable TV tower in Chunwan. She had been to Wen Chai. Well, she had been to the birthday party at the Spanish restaurant in Wen Chai. And with a confirmed case 12838 and another friend, they went together to Connaught Road West. We need to confirm whether that's a place for drinks or a restaurant proper. So she stayed with her friends there for some snacks before they went to the birthday party at the Spanish restaurant. Well, because they had been to the party, and from the organizer, we obtained a guest list beforehand, and the guest list contained names that the organizer were aware of, but there are altogether 192 people on the name list, and we identified 180 people from the list. After 9:30 p.m., those who were there after 9:30 p.m. were 92, and they were all sent to quarantine. But this case and another person who actually also had appeared at the birthday party and drank together with her in the restaurant on Connaught Road West, their names were not on the list. As far as we could find, the organizer actually knew of the people on the name list, but the invited guests could bring along their friends who might not be known to the organizer. Therefore, the organizer does not have the full list of the people who went to the party. So let me call on again anyone who had been to the birthday party, please, as soon as you can, contact us. Call our hotline to contact us. And they will need to be subject to compulsory testing. So let me remind the public again. You must strictly comply with the requirement for compulsory testing. And also, even for those who have been vaccinated, they need to go for compulsory testing if needed. We will swiftly follow up on anyone or cases who have not complied with the requirement. And for those who fail to go for the testing, they would have committed an offense and are liable for a fine of $5,000 and the given the compulsory testing notice again. If they do not comply again, that means they have committed another offense. They could be fined further up to $25,000 and subject to a sentence of 6-month imprisonment. And also, on the results of our previous genomic sequencing test, earlier there was a case with unknown source. That is the worker who worked at the supermarket. The genetic analysis found that compared to the big cluster with case number 12676, the genetic components are quite similar, but we have not found yet the direct link between her and other cases. So there could be still some invisible transmission chains in the community, so we are a bit worried. So we hope that all of you could follow the social distancing rules, and if you have any doubts, go for testing as soon as you can. So now I'll ask Dr. Ho to report to us the situation with the hospital authority. Good afternoon. By 9 a.m. this morning, in the past 24 hours, the hospital authority received 30 cases. We've got 41 patients now who have been discharged. And so far, we've got 12,284 patients who have been recovered and discharged. We still got 368 patients under treatment at the North Lantau Infection Control Center and also at the community centers actually under treatment in Lantau and other places. They are in stable condition. Bed numbers, 1,058. Utilization rate is 55%. The number of negative pressure wards is 606. Utilization rate is 67%. So it's now time for question and answer. Please raise your hands. And before you ask your question, please tell us which media outlet you're from. The first one at the back. Lady in black, please. I'm from Now TV. I'd like to ask about the case of a 20-year-old woman. She had been to a Chinese medicine practitioner and collected some medicine. Has she got some illness? Has she gone for testing? And also for the 43-year-old woman, when did she go to the party? How long did you stay there? For people who had their quarantine order quashed, would they need to go back to the center for quarantine again? And also for the shop assistant, which case is she closest to in terms of her genomic sequencing? The 20-year-old girl, she had no symptoms. She actually should have seen the Chinese medicine practitioner for another reason. The 43-year-old woman, well, with the case that we found earlier, they together arrived at the venue at the same time, which is about 9:30, which is about after 9:30. Around 10, shortly after 10 p.m., they left the venue. So for people who need to be quarantined, our policy remains the same. That's who stay there after 9:30 would need to be quarantined. But since now we have found two cases, or one case and her friend who had been to the party, but we don't know who they are actually. We didn't know about them beforehand. So we're worried there may be other people, who might have gone to the party individually without being on the guest list. So they need to contact us as soon as they can.
And about the genome sequencing for the supermarket worker, for cases, the cases are related to 12767, who ate at the Six Garden restaurant. The gene sequencing is identical with that of the sales lady. We don't know how she got infected. There is possible community transmission, and we are worried. The gentleman in the middle. I'm from Cable News. The 43-year-old person who worked in Cable News, which building does he worked in. There are two buildings, one for news and the other for other programs. So which building does he work in, and what is his job? The birthday party involving a lot of top officials. Did any official fail to use a Leap Home Safe app, and has any restrictions rules been flouted? We should check the CCTV footage to see whether there are people who were there but not on the list. The cleaner at the airport, is she considered to be import-related case, or are you still investigating? The 20-year-old part-time Sogo worker, which Sogo is it, and which floor? What is her working hours? Thank you. The staff member of cable news, it seems that he doesn't work for cable news. It's just that his office is in the building. More details will be available in our compulsory testing notice today. There are different ways to identify close contacts. Leap Home Safe app is one of them. If it is not available, we would use other means. We don't know as a fact that everyone there used the Leap Home Safe app. For those who told us that they remained after 9:30 p.m., they would be considered close contacts. For those who left before 9:30, we would ask them for proof. For the cleaning lady at the airport, it's just confirmed that she has worked on a flight with many confirmed cases on board. She met with some cabin crews who are not confirmed cases. The gene sequencing is not available yet. It should be available in the coming 2 days. The Sogo we are talking about is the one in Causeway Bay. The patient's last work on the 28th. It's not likely that there is a transmission chain in Sogo. We are investigating the circumstances under which she worked. On the 27th, there was a case who went to Sogo. That's why we are tracing the contacts far back, because we are not sure what the source is. She was there on the 27th in Sogo. That's why she had a test on the 1st, tested negative, and then another test on the 8th, testing positive. That's how we found the case. We're not sure whether she is linked with the Sogo patient. Next question. An English question.
Afternoon from SCMP News. I have a few English questions. The first question is on how many experts are now calling on authorities to ramp up social distancing measures if there are more untraceable cases popping up. So do you see that more untraceable cases are popping up? And does this mean that the public can expect to prepare for more restrictions on Chinese New Year? And also for the 43-year-old woman who went to the party, are you worried that more cases may come up from the birthday party afterwards, especially those that came before 9:30 p.m.? And does this mean there may need to be a U-turn if there are more cases detected? And also for the 58-year-old who was untraceable previously, how many close contacts of hers has been identified and sent to quarantine? And my last question is on case 12825 and 12880, who went to an alumni gathering with around 70 people. Did you find anyone else who was tested positive there? Thank you.
We indeed have found at least one more untraceable case at the moment. So we are worried that there are silent transmission chain in the community. So I think the public has to keep social distancing measure at least for the coming 1 or 2 weeks. And for the 43-year-old lady who went to the party, she actually went with another case, the index case, to the party. So based on these 2 cases, and also they had drinks and snacks together before they went to the party. So it is possible that she got the infection from the other lady through these drinks and snacks, and maybe through the party. So based on these 2 cases, I think our current classification of close contact is still valid. Of course, because there are silent transmission in the community, we cannot exclude there may be other cases among those participants before 9:30. But based on the current assessment, so they are not considered as close contact at the present moment. We have not identified other cases among those participants who went to the gathering with 12825 and 12880. We have quarantined those participants already.
下一位呢邊第三行黑色衫位女士。
Next question, the lady in black. Good afternoon, Hong Kong Economic Times. The so-called preliminary positive case, what's her shop called? And Typo Mason building, how far apart, how many floors apart are the 2 flags? Do all living on the same floor have to be quarantined? The preliminary cases today, did they have symptoms and did they get jabbed? Ling Liang Church Kindergarten, is it that only 1 student has to be quarantined? About the party, you said 92 need to be sent to quarantine centers. Have all been sent to quarantine center now? And how many friends were brought along to the party? How many people are not on the list? Today you said 190 something people went to the party, much more than previously announced. Why is that? How was the cable news building case identified? Is it through Leave Home Safe app? Did he approach the CHP telling you that he has been to the party? If not, will there be follow-up actions about him? Vaccination. The 66-year-old female has been vaccinated with 2 doses of Sinovac. The lady living in Mason Building. The flags are 6 floors apart. More details will be available after the site inspection. The 88-year-old lady, she is not jabbed. The 20-year-old girl working in Sogo, she hasn't been jabbed as well. The 43-year-old lady, 2 doses of Sinovac. The Ling Liang Church Kindergarten, 3 students were presented with upper respiratory symptoms. One of the students studies in the same class with this patient. The other 2 are not. Altogether, there are 3 students with symptoms in the school. All were tested negative. The classmate has to be quarantined because he is a close contact, and all in the school has to be tested compulsory.
After 92 of them, I think they've all been sent to quarantine, but I don't know when they were sent there or have all them have been sent, but I think most should have been sent anyway to quarantine. For the new 43-year-old female case, she had gone for testing. According to what she said, she notified her friend on our list. Well, the list that we've got was provided by the organizer. So we're not have been given all the full information. We are not sure at this moment how many people are on the list. I mean, who are the friends, how many friends there are of the people who are on the list. So let me make this appeal again. Anyone who had been to the party and who had not let us know, and if nobody contacted them, please get in touch with us. We have issued compulsory testing notices for various places. For people who do not go for the test as required, that's against the law. Linked one in white mask. Dr. Zhang, I'm from TVB. For the 43-year-old case who's preliminary positive, on January 3rd, what places has she went to? And when actually was she sent to quarantine? And for the child case, I can see that the 3-year-old confirmed case, he was confirmed only 7 days later. And for the 4-year-old child of the surveyor, he was confirmed positive only after several tests. That's the Center for Health Protection found that. Is it that the incubation period for children will be longer? Is it different with Omicron? And also, for the foreign domestic helper cluster, do you think that there's a need, like last year, to carry out a 30-wide, large-scale compulsory testing for foreign domestic workers in Hong Kong? And also, as you mentioned earlier on, previous cases tended to be concentrated in Causeway Bay, Wan Chai, and so forth. But now we've seen cases in Tai Po. And the confirmed cases have been to different districts. So is it that not just on Hong Kong Island alone? Are we seeing the trend where, risk is high in Tai Po as well? Do you think there's a need to tighten the social restrictions rules further? For the 43-year-old preliminary positive case, the woman, on January 3rd, she went to the party, and then on January 4th, she went to work. She had lunch at the restaurant with 3 other people, and January 5th, she went to work, and she also had lunch in Tsuen Wan, a cooked food center in Tsuen Wan, for lunch. And I forgot to mention that in the afternoon, from 5 p.m., close to 6 p.m. and to 10 p.m., she went to Happy Valley Jockey Club. I had dinner there as members. She was in a room with 2 tables. And she didn't know the people on the next table, but she went there. She was having dinner with 2 other friends at a table. But the 2 tables are in the same room. It's not really a big room. So for people on the 2 tables, they will be classified as close contacts. Besides eating in the room, at 6:30, she went to the race course and stayed for about 10 minutes. So people who were at the jockey club then are subject to compulsory testing. 6 and 7 of January, she stayed home, and on January 8th, she went for compulsory testing, and it's discovered that she's preliminary positive. For the foreign domestic helpers in Hong Kong, we've got 4 cases so far. All of them have been to the church we mentioned before, and so far we haven't seen cases unrelated to it that actually were infected, of course, but the helpers spread the virus to the family, people in the family. Hong Kong is a small place. Some cases are related and some may be discovered at quarantine center. And before cases were sent to quarantine, people could have infected other people, and because people went to Hong Kong, Kowloon, other places. So I can't say which particular district is high risk. Any district could have traces of, the chances of being infected. For the child, it's difficult to say because for some other cases, they were actually confirmed positive only after several tests. It's all because of the incubation period involved. So you could not identify the virus the first time. Once, like if you are sent to quarantine quickly enough, say for the case in Mason Building, the first test that you had, result was negative, and it only was, confirmed after the second test. So we need to conduct several tests sometimes to find if a case is positive, and people need to stay at quarantine center till after they've passed the incubation period. This person at the back, AM 730, for the preliminary positive case, the 88-year-old woman. Which block does she stay in at Ming Hua Building? For her family, at the massage parlor? What sorts of services do they provide to the confirmed case? Where does the risk lie? And also for the 22-year-old case, she also went to Sushi Row. So for the what is your definition for close contacts at a sushi bar like that? Because people could be in close contact with each other while enjoying the sushi bar. And also, what do you think of locking down of buildings? Do you think locking down of buildings may not be so useful in identifying Omicron cases because it takes time for cases to be identified? And also for the 43-year-old woman, you said that before she went to she went for drinks with a confirmed case in Sai Ying Pun. How come that she went for testing the next day? And why wasn't she sent to quarantine when her friend was classified as a close contact? And also, what is the progress of the restaurant whose customers were called on to contact the center? It's block 1 for Ming Wan Building. Sushi Road, the time frame is 5:30 to 6:30. We haven't seen any cases or found any cases at Sushi Row, so we don't know whether this place is high risk or not. So we need to get everyone to get tested first before we know what the situation is, or whether how many or who need to be quarantined. For the 66-year-old case, well, in terms of locking down of buildings, we hope to identify cases as soon as possible. But there's an incubation period, so we will not know immediately if someone is infected. But at least we've done the first round of testing, and the residents there will still need to go for further testing in the following days. So it's not possible for us to find all cases in a locking down exercise. And just because we cannot rely on just locking down exercise to identify all cases. Theoretically, Omicron's incubation period is shorter. So I think locking down may be even more effective in that regard. For the 43-year-old case, well, we really don't know all the information. We only knew today that the previous case had been to another place for drinks and snacks. We only knew about it today, and she had not told us about this latest venue.
如果係根據
Under 599D, we have asked her about her whereabouts many times. If it is found that she has lied to us, there would be follow-up actions. What about the food massage parlor? She's the masseuse. The family member of this preliminary positive case is the masseuse for another patient. So now she is the close contact. The new preliminary positive case is the family member of the close contact, so they were sent to quarantine center together. We suspect the close contact to be a patient as well, but testing is still required. There is no update about the investigation with the restaurants, including the 6 garden restaurants. Today is the 9th. A certain some time has elapsed. Next question. Good afternoon. Points News. They're saying that small-scale lockdown is not effective in identifying patients. Should we learn from Zhengzhou and Shenzhen in carrying out a compulsory testing for all population? Has the government studied this idea? Omicron has been rampaging in Hong Kong in recent days. How do you think we should hold Cathay Pacific to account? We're now focusing our resources on tracing cases. We are focusing on areas where positive cases have been found, including Mason Building. If there are a high number of untraceable cases, of course, the government will not rule out any other methods. The last question, Mingpao Daily, about 3 places, 6 garden restaurants. You said there is no progress. So East Ocean Lafayette and the party after 9:30 p.m. I mean, how many close contacts are yet to be found? The 20-year-old sales lady at Sogo, what's her city value? You estimate that her onset was quite early, so how high the infection risk is. Now, the supermarket lady, after genome sequencing, how does the CHP classify this case? An import-related case or untraceable case? Well, it seems that we have more than one case which is untraceable. So should we consider more stringent measures, including suspension of schools? You said the 43-year-old lady had some drinks prior to the party. So how many people were involved?
睇先啦。嗰個20歲女士
The 20-year-old lady, her city value was at between 24 and 31. The supermarket lady, her gene sequencing result is similar to other cases. However, no epidemiological links can be established with other cases. So we are treating this case as an untraceable case. If we have more cases with the same gene sequence, then it would be a common strain. For the previous cases, we were able to pinpoint where and when the patients had contact with other patients, but not for this one. If there are more unrelated cases surfacing in the community, of course, the risk would be high. And I believe the government is closely monitoring the situation daily to decide whether stringent measures are required. There were 5 to 6 people having drinks and snacks, including the 2 patients. This is the end of today's press briefing. Thank you. Yes, We have a list. I don't have the most updated number. Very few people used cash. Some 130 people paid other than cash. We don't have the updated information. No one has approached us from Six Garden Restaurant. 9:30 p.m. party. We are worried that there are people we still haven't found. Yes, because they are required to undergo quarantine. Sorry, the speaker is not coming through the mic. There should be legal consequences. Sogo, the Sogo lady. What about compulsory testing for Sogo? That's case 12821. On the 27th, she went to Sogo.